enable.
Mahatma Gandhi once said, "It is health that is real wealth and not pieces of gold and silver." How profound were his observations. Wish millions of Indians had heeded his advice, but alas, that was not to be. Today, India is not a picture of health. More than 100 million Indians are suffering from various types of diseases that include both lifestyle and non-communicable diseases. For instance, India is emerging as the diabetes capital of the world, with as many as 50 million people suffering from type 2 diabetes, and another 30 million will soon enter the unenviable list. The scene is no different for heart diseases or cancer. Effectively, these rising numbers of patients are putting a huge strain on the country's healthcare infrastructure. And nowhere is this more evident than the fact that India has only 0.9 beds per 1,000 people, significantly lower than the standard of 5 beds per 1,000 laid down by the World Health Organization. Likewise, the doctor-patient ratio is also way below the standard laid down by WHO. In spite of these huge shortcomings, the medical practitioners in the country are doing a great job by providing succor to the patients and improving the outcome ratios. Clearly, these silent heroes need to be recognized and honored for their exemplary services 24/7, displaying positive attitudes and constantly trying to improve the healthcare delivery system in the country. It is with this thought in mind that CNBC TV 18, in partnership with ICICI Lombard General Insurance, instituted the India Healthcare Awards in 2010. This first-of-its-kind initiative is our way of saluting the heroes who go beyond the call of duty to make patients comfortable and happy. The awards, now in its 8th year, has become a benchmark for excellence in the healthcare sector, and there's no better proof of this than the number of entries received year after year. This number has grown from 1,300 in 2010 to 4,500 this 2018. And the people who made these big numbers possible is India's leading market research agency, Kantar IMRB. But what makes the awards definitive is the commitment of its high-caliber jury, and they are Dr. Sudarshan Ballal, Chairman, Manipal Health Enterprises; Keval Handa, Chairman, Medibiz Pharma; Annaswamy Vaideesh, Vice President, South Asia and Managing Director, GlaxoSmithKline Pharmaceuticals; D.J. Shah, Secretary General, Indian Pharmaceutical Alliance. It is their eye for detail and exacting attitude that has raised the bar for the awards and helped them recognize over 125 hospitals over the past 8 years. Some of the winners in the past were AIIMS, Hinduja Hospital, Dr. Devi Shetty, Dr. Badrinath, Sri Satya Sai Mobile Hospital, Tata Memorial Hospital, and Jaipur Foot. Besides recognizing the outstanding performers, what this platform has done is create awareness about lifestyle diseases and focused on the preventive part.
This Healthcare and Wellness Award of CNBC TV 18 and ICICI Lombard is one of the best awards in India. I would say it's like the Oscar Healthcare Award. And this has been running for almost about 8 years today, and more than about 4,000 nominations we received. And from there, we have to bring it down and shortlist to 10 to 20 nominations, and then the fine juries discuss this and awards. And many times you find that the discussions are very, very emotional, very, very passionate, and both quantifiable data in discussions as well as the qualitative discussions.
CNBC TV 18 Healthcare Awards have really created an awareness about the quality of healthcare available in different cities, different towns, and even in the government hospitals. And as your own data shows that more and more hospitals are coming forward to participate in this healthcare awards, which becomes a guide for the patient and the doctor in selection of the hospital.
With the awards gaining popularity for its gold standard, we felt the need to democratize more information in the healthcare space so that patients could make informed choices. Accordingly, we added a new category, Wellness, this year and rechristened the award to India Healthcare and Wellness Awards.
Adding wellness to this award is very critical. As you know that our longevity in our country, average longevity is going up as compared to what it used to be many years back. So when people are dying at the age of 45 and 46 in 1945 or 46, where the whole focus is on making sure they don't die at that age, right? By giving medicines and giving the kind of care. But today people are living at average longevity is 67. That means there are people living at 75 and 80. Now the quality of living is important. Healthcare, you want people to age gracefully. How would you grace agefully? Unless otherwise you do prevention and promotion of healthcare. So it's time that we need to start recognizing prevention as a very important aspect of healthcare rather than just only a breakdown healthcare. So rightly so, we have added this time preventive healthcare is a very important, and promotion of healthcare is a very important aspect of awards.
I think this initiative is brilliant. It's one of the kind. Wellness is something that's truly not recognized in this country, and there are a lot of brands trying to make headway in this space of wellness. So the awareness creation by this award is just going to give brands a catapult to the next level, where a person like me who's a consumer will say, hey, you know, this brand has won an award and it's been ratified by eminent people and the industry. So it's going to make people more adventurous to trying wellness. So I think brilliant initiative, and I hope that next year there are going to be far more greater entries in this space.
CNBC TV 18 has been doing the awards in the other sectors, and for them to think for wellness, it's a great initiative. It's a start to give a kickstart to the wellness industry, which I have already said is a sunshine industry, and a lot needs to be done. So I think CNBC TV 18 is very creditable, and they are taking the step in the right direction.
Besides, we chose transforming healthcare via technology as the theme for this year. Clearly, technology disruptions are revolutionizing nearly every aspect of the human lives, even more so in the healthcare sector. Thanks to technology, it is possible to make healthcare affordable, accessible, and available. Startups in particular are making an indelible mark on the field. Take for instance GOQii Life Sciences, which has developed a handheld device that enables early detection of breast cancer at a cost of 65 rupees per scan. Similarly, the Delhi-based Rahul Rastogi has developed a matchbox-sized ECG machine that will cost just 5 rupees for ECG. Elsewhere, Dr. Naveen Khanna has developed a test kit that can do dengue diagnosis for 140 rupees per test. And while startups are driving affordable innovation, big hospitals are also betting on technologies like artificial intelligence, robotics, Internet of Things, cloud computing, and other new age technologies to bring healthcare to the masses. On that note, it's time for a short commercial break. When we come back, we will look at how the Bengaluru-based Manipal Hospitals has adopted technology to improve healthcare delivery. Stay tuned. Welcome back. Technology has indeed revolutionized our lives. Take banking for instance. It is a generational change. Nobody visits a bank. It is done via desktop or through smartphones. The healthcare sector also seems to embrace technology big time. Just a few years ago, India's healthcare sector was underpenetrated in terms of technology adoption and was lagging behind other industry verticals. However, the scenario is changing. Take the case of the Bengaluru-based Manipal hospitals. It has many firsts to its credit when it comes to the adoption of technology. For starters, it was the first hospital in India and among the first few in the world to adopt IBM's Watson platform for diagnosing cancer. It is also the first hospital to install Massimo Patient Safety Net, a remote monitoring and clinician notification system. Its ambulance service, Manipal Ambulance Response Service, is equipped to handle emergencies of any kind and is monitored through a central control room. Manipal Hospitals has also been analyzing its health information system data, particularly on the progression of kidney disease in patients.
Manipal Health Systems or Manipal Health Enterprises has always looked at the best of people and the best of technologies to help our patients requiring medical care. And as far as technologies are concerned, we have always been in the forefront, starting way back in the 90s when we were one of the first few to start MRIs in our hospital, lithotripsy, PET scan, so on and so forth. Now, the way we look at technology is first, what is the use for this patient? Second, what is the experience with this technology in the rest of the world? And the third is certainly, is it something that's affordable to the hospital and also most importantly to the patients? So these are the three main parameters we look at before we adopt any technology.
Manipal Hospitals is also betting big on robotic assistance, which can reduce complications like blood loss, trauma and pain. The procedures can be made more economical and allow surgeons to operate with enhanced vision, precision and control due to the size and flexibility of the remotely controlled surgical instruments.
See, robotic surgery is certainly something that is very unique. It's an extension of minimally invasive surgery that started decades ago in the form of laparoscopy. And there was very widespread experience in robotic surgery, especially in the US, where they looked at very specifically in the fields of urology, like prostatic cancers, and of course in the field of oncology. And we were very impressed with the technology and also the possible use for our patients. Our surgeons were very enthusiastic, and we took the call that we should be one of the first few to bring this into our state and in our country and use it for the common man.
With robotic surgeries offering benefits like a smaller incision on the body, less pain, and a reduced length of stay at the hospital, more and more patients are requesting for it. As a matter of fact, Manipal Hospitals performs on an average 1 to 2 robotic-assisted surgeries a day. It has performed over 1,200 surgeries in the last 6 years to treat urology, oncology, gynecology, cardiac problems, etc. That's not all. Manipal Hospital has also upgraded its robotic system from the Da Vinci C to the new Da Vinci X system in September 2017, making it the first hospital outside the USA to do so.
If you see that for over 7 years, we had a robot called as Da Vinci S. That was the initial, we have first generation, second generation, third generation. So Da Vinci S and SI fell into second generation robots. We were able to do a lot of surgeries, but the new technological innovation, imagine the robot has a supercomputer intervened between the patient and the surgeon. Now the new X robot, which only we have in India, it has got certain technology like we have a green laser. I can use an ICG technology called Firefly. I can see where are the sentinel lymph node. So I can do a surgery which is more precise. You know, I'll tell you one example. You have something like carpet bombing, where you just bomb, the whole area is destroyed and still everybody is killed, but you know the collateral damage. Suppose if you have a precise missile attack, you don't have a collateral damage and you hit it. So if you have an image guided, laser guided, Firefly, ultrasound guided surgery, you not only do what you want to do, you disturb the surrounding area least. So we were able to do renal transplant. Our renal transplant program picked up tremendously with this. Our GI surgery, liver surgery, gastric surgery picked up because of this. and then the laser precision surgery, we moved complete to a concept called a sentinel lymph node biopsy from this. And then the holes have been reduced from 12 mm to 8 mm, so further small cuts to the patient. So this Robotic has got so many new things that has come into that bundle, which change a lot of technological program for them. The same surgeries we did efficiently with lesser cut, we added more surgeries to be done, very precise. So that made a good quality of life benefit to the patient.
Clearly, robotic surgery is transforming the quality of treatment provided to the patients by reducing intraoperative as well as post-operative complications. On that positive note, it's time for another short break. At the other side of the break, we look at how technology is helping the masses stay fit. Welcome back. Today, Indians are becoming more and more health conscious, at least in urban India. And this is evident if one looks at the sales of sportswear, sports shoes, wearables, health foods, coupled with the mushrooming of gyms. It is commonplace to see people of all ages walking, jogging or cycling. Staying fit is the new mantra, and many are using technology to track their fitness levels. Healthcare apps, gadgets or wearables are proving beneficial to maintain a healthy regime. These gadgets are replacing the need for personal coaches, and everything right from how many calories were burnt to counting the heart rate while doing exercise is just a finger touch away. Fitness apps provide step-by-step guides for simple exercises. Gadgets are clearly revolutionizing the healthcare landscape for the urban citizen.
So first of all, GOQii is way beyond a fitness gadget. We are a complete health ecosystem. The device is just your entry into the ecosystem, which tracks various things like your heart rate, your steps, even your blood pressure. But the key goal of GOQii is to connect this to doctors, health coaches, health experts, so that we advise you and motivate you to be healthy. So what we have seen is that just devices or just fitness apps, log use karte hain and within a few weeks they are off it because nothing is pushing them or motivating them. However, in the case of GOQii, because of our unique approach, people are not only sticking to GOQii, they are also becoming fit and healthier and also getting other people on the platform.
The importance of exercise cannot be overstated, but keeping a check on your diet is just as important. One doesn't have to be a doctor to know that wolfing down oily parathas for lunch negates the benefits of the morning walk. After all, our lifestyles are nothing but a series of habits. Studies show that if people were to take 1 or 2 healthy habits at a time and practice it for 21 days, there are higher chances of that habit becoming part of our daily routine.
See, another very important thing about health is it needs to be holistic. It is not just about exercise or nutrition. It is also about sleep. It's also about mental health. It's also about meditation. It's also about giving back to the society with karma points. So what we have done at GOQii is we have put all these elements. For example, our device can track sleep. We have a meditation module within the app itself. And the more active and healthier you get, we give you karma points which you can donate to charity. So the goal is we have to attack motivation from all ways, not just about you motivating for yourself, but you motivating for the larger good of the society too.
Not surprisingly, technology is redefining the way healthcare is delivered today, right from motivating people to following their fitness regime to performing complicated surgeries through robots. Experts from the industry predict that India will leapfrog to new age technologies that will deliver healthcare services at the home of patients, and the medical practitioner will remotely monitor the patient's health with the click of a button. It's only a matter of time that healthcare would be accessible, available and affordable, just the way banking is today via our smartphones.